Hello and welcome to the channel. My name is Dr. Tasha and I am a breast cancer surgeon. And in this video, I'm going to be guiding you through how to examine your breasts the correct way. The video is divided into two parts, so make sure you stick right to the end, by which time you will have the skills and the knowledge to know how to do a breast examination the correct way. So let's get started. The first part of the examination is the looking part. This may sound obvious, but first of all, what you need to do is to be completely undressed from the top half. Then stand in front of a mirror. Raise your hands above your head and then place them on your hips and press against them. The reason for doing those actions is because sometimes lumps as well as puckering and dimpling of the skin can be more obvious when you do these actions, so make sure you do them. The other thing is, if you can't see the curved bottom part of your breast, then you need to lift them up to make sure that you look into these areas as well. And whilst you're doing these actions, these are the things you need to be looking out for. Number one, any obvious lumps. Sometimes you can actually see lumps that changes the contour and the shape of the breast. Number two, any obvious skin changes or rashes. Do you see any redness, skin texture change, or eczema-like skin changes, especially around the nipple area? Number three, do you see any dimpling or puckering of the skin? What I mean by this is the skin is drawn inwards towards the breast. Number four, look at your nipples. Are they retracted and are going inwards? Now, this can be quite normal and many women have inverted nipples, but if it's a new thing, then you should get it checked out. And lastly, look for the presence of spontaneous nipple discharge, and this may stain your undergarments. Once you've done the looking part, the next step is the feeling part of the breast examination. And you can do this in the shower, while standing up or lying down on the sofa or your bed, wherever it's convenient for you. People ask me, what am I feeling for? And the answer would be that you are feeling for lumps or an area of fullness that is more obvious compared to the other breast, or really any changes in the breast that you haven't noticed before. The best way to examine your breast is by using the flat of your fingers. I have seen people pinch the breast or prod the breast, and I would really encourage you not to do it this way. In fact, if you do it this way, you may actually miss feeling any lumps that may be present in the breast. Examine your breast as if you're putting moisturizing lotion onto the skin, and that way you remember to use the flat of your fingers. It is really important to make sure you examine the whole of the breast. In fact, the breast occupies quite a large area. It occupies the area from the second rib, which is just below your collarbone or your clavicle, all the way down to where the breast curves into the chest wall. It then extends from the sternum, which is your chest bone, all the way close to your latissimus dorsi muscle, which is right to the side here. It also extends all the way to the armpit. So that is the area that you need to examine. We all have our different systems to make sure we don't miss out on areas. Some people divide the breast into 4 areas with an imaginary line that goes up and down and left to right, and then they examine the breast per quadrant. Others start from the center and in a circular motion move outwards like a spiral and examine the breast that way. Some people move from side to side, starting from the top and gradually working their way down to the bottom of the breast. It doesn't really matter. The most important thing is to make sure that the whole of the breast is examined. So let's start. You will examine the breast with the opposite hand. So if you're starting with your left breast, place your left hand behind your head and then using your right hand to examine it. First of all, you start feeling the breast with a light pressure, and obviously you examine the whole of the breast, not forgetting the nipple area. And then you repeat the whole process, but this time with a little bit more pressure, and that way you won't miss anything deeper in the breast. If you're hurting yourself, then you're probably going a little bit too deep. Once you've done one breast, then you'll obviously have to repeat it with the other breast. The last thing that you need to do is to examine your armpits or your axilla. And the way to get into your armpit or axilla is actually by having the arm either by your side or across your body. By doing that, you're actually counterintuitively opening the armpit, so it actually makes it more accessible to feel around. And then, of course, you do the other side as well. Lumps can be quite obvious to feel. Sometimes they can be round and movable. However, other times lumps can have less defined edges, feel rather firm and not particularly movable. They can also vary in size from small pea size like to broad bean, a Malteser, or anything even like a golf ball. Other questions I get asked is how often should I examine my breast? And you should do it once a month, regularly if you can. You don't have to do it more often than that. If you are premenopausal and your breasts can get quite lumpy or swollen before your menstrual cycle, for example, then wait until they return back to their normal state. Don't worry if you forget and miss a month. The most important thing is for you to get to know what your breast feels like and do it as regularly as you can. The more often you examine them, the more familiar you will be with what normal feels like. If you find a lump or something that isn't quite right and needs to get checked, then your GP or family physician will refer you to a breast specialist. Here you'll be examined and probably have some scans as well. Quite a lot happens in a breast clinic, and if you want to know more about what actually takes place, then you can check out my video that explains it all. So now you know how to examine your breast. It shouldn't take long, and I hope this has been helpful. Take care and see you in the next video.